Okay. Hello and welcome to all of you who are watching this. I'm Benedicte Symcox and I'm Chief Exec of Family Voice Surrey. As many of you will know, we're the Parent Carer Forum for Surrey, and we are thrilled to be hosting an event full of speakers and videos and conversations, all focusing around early years, and we're thinking kind of 0 to 6. So all of you who have children either before or getting up into school age, what are the challenges, what are the positives, what's the information that will help you navigate your child's early life? And if they have an additional need, how do you know? How do you find out, and how do you find support? I'm absolutely thrilled to be joined today by Fran Beale from Shooting Star Children's Hospice. One of the things at Family Voice that we try to spread the word about is the range of families that we represent in our work. And we represent families who have a child with additional needs aged 0 to 25 and with any level of additional needs. So you might have a little boy who's struggling with some literacy difficulty or speech and language. You might have a child with severe learning disability or autism, or you might indeed have a child who has a life-limiting condition at whatever age. And that's really where our conversation is going to be focused, isn't it, Fran?
It is.
So after all of that waffle, I'm going to say hello and welcome, Fran. And would you like to introduce yourself and what you do and what Shooting Star is?
Yeah, thank you. So I'm Fran Beale. I'm the Family Support Worker Lead based at Shooting Star Children's Hospice in Guildford. The hospice is known as Christopher's. So Shooting Star Children's Hospice, we care for babies, children and young people with life-limiting conditions, but we also support the families. We are a leading children's charity, and we support families with children from diagnosis to end of life and throughout bereavement. We cover all of Surrey, which I know is where obviously the families joining us today are from, but we do also support 15 London boroughs. So we have a really kind of wide spectrum of care across Surrey and London.
I wonder, one of the things you mentioned just before we pressed record, we were talking about this, in the spirit of full disclosure, we were a Shooting Star, a Christopher's family. My youngest was diagnosed with leukemia and a congenital heart defect and was life limited. And Christopher's was a lifeline. And I think one of the things that's really interesting to me is that Shooting Star is a bit of a jewel for Surrey, because children's hospices aren't nearly as common as adult ones, are they? And you were telling me, I can't remember, how many children's hospices are there nationally?
So I believe there's approximately 50. It may be slightly more, it may be slightly less. But I think in comparison to adult hospices, that's quite a small number. Yeah. And children's hospices only receive, I think it's approximately 10% from the government in terms of funding. So we're very much reliant on fundraising to be able to run and offer the services to all our families. So it's very limited.
One of the things I was really interested in the work that you do, and I suppose my son is an example of that, is not all children with life-limiting conditions will die in childhood, will they?
Absolutely.
And one of the reasons I really wanted to have a talk with you is an awful lot of the conversations and the thinking that we do and that professionals do when they encounter a child or family with a child with additional needs, is the professionals very quickly start looking to the future and saying, what will this child need later on, either for school or for secondary school or for independent life? And it seems to me that if you have a life-limiting diagnosis for your child, conversations about the future they almost feel insulting and difficult. And I wonder, particularly in your role as family support lead, how much do you have to think about supporting a family towards looking forward to the various different possibilities that might be?
Yeah, I mean, again, like you say, we do have a number of families where potentially, you know, their child is well for a considerable number of years. So we actually have a transition coordinator. So she supports our families with our young people 16 plus to transition into adult services, which again, that's a really complex time for families, because you're falling under those children's services. Like you said, Benedicte, you know, you're not sure what's going to happen in the future, and you don't anticipate necessarily that you're going to have to plan for adulthood.
Yes.
So having that support, that coordinator in place has been an absolute lifeline to a lot of our families.
And I remember just planning for primary school seemed ridiculous, actually.
I was just going to say that we do a lot of support with families around education, health and care plans. We do a lot of support around the continuing healthcare assessments. We support families around the children and family assessments that they may have within social care. And all of that is to enable them to get the right package of care, be it in the home, be it out in the community, or maybe with us. You know, it's a big wide world, and there's a lot of services out there, but I think again sometimes we just don't know what's available to us.
And what you're describing, I don't know the world of hospices generally very, very much, but it feels like there's something very unique about a children's hospice as opposed to an adult hospice, because an adult hospice feels very much like a one-way and quite time-bound process, whereas you are presumably potentially supporting children, young people for a significant number of years.
Yeah, so we support children and young people up to the age of 21. Right. So it's so from 0 up to 21, and throughout that time they have access to a lot of our services and our teams that work within the hospice. I mean, it might be useful. Shall I go through kind of and just let you know the teams? And
I think that would be lovely, because I think, you know, that word hospice can be so frightening, can't it?
And it can. And, you know, I think one thing for me is I certainly feel privileged to be able to work with Shooting Star Children's Hospice. You know, being able to support families actually is probably going to be one of the most difficult, or if not the most difficult time of their life, and be able to kind of put that support in place for them. For me, you know, I feel privileged to be able to do that. So within the hospice, so we have 2 hospices. We have Christopher's in Guildford, which is our Surrey-based hospice, and we have Shooting Star House in Hampton. So Shooting Star House in Hampton unfortunately closed during the pandemic. So it was a hospice, again, that had all the clinical care and the respite. But like I say, we did have to close Shooting Star House during the pandemic. So all of our clinical care and all of our respite care currently falls under Christopher's in Guildford. So within there we have our in-house team who support all the children that would be staying in-house, and that could be for planned respite, could be for an emergency respite stay, which could be social or clinical. They would support our children and young people at end of life. So their role is really, again, it's very, very vast in terms of the support that they give, but theirs is predominantly for those children and families that would be staying in-house with us.
Right.
We have our community team, which is built up of 4 nurses. And again, they would be, again, in the title, community, so they would very much support families out in the community. They really focus on our most vulnerable and clinically unstable children. So again, they would go out and maybe do some sort of time-bound work with those families in terms of that support within the home. But they also support the local community nurses around the end of life care. So their role is very structured, it's very kind of niche in terms of what they do.
Yeah.
We also have our family support service, which is the team that I sit under. And within that team, we have counsellors, children's therapists, we have a transition coordinator, we have social workers, we have a team of family support workers who I manage. We have me, which is the lead, but I also support families around their statutory funding to be able to get funding for nights to stay at Christopher's. And then last but not least, we have our space team, and they very much focus on the symptom care of our children. So we're a very, very vast team with a huge range of services which focus on very much the clinical side of a child or young person's care, but also the social.
Do you know what it's really interesting, and so one of the questions that I have for you before my mind wanders a little bit.
Sorry, that was a lot of information there.
No, it was really. I wondered, do you know how many children in Surrey that you support currently?
Oh, in Surrey, I'm not 100% specifically in Surrey, but I know that we have approximately about 500 children within our service.
Yeah.
So and they're kind of split from Surrey Heartlands, Northwest London and Southwest London, but it is very much a third of each. So yeah, so if a third of 500 really. So
yeah, so it's really interesting, isn't it, to understand, I suppose, the scale, because I think most of us, the idea of a child with a life-limiting illness feels very, very rare, and I suppose in the scale of it, it is, but actually for those 180, I don't know if my maths is right, families, that's a lot of families who are living something that none of us as parents expect to, particularly in this day and age. I think one of the things I wanted to, I suppose, bring in is I was listening to describe quite professional and time-bound roles, which were wonderful. And I was layering on that my experience at Christopher's, and it fits beautifully. But as a family, what was so special about our experience with Christopher's was it was really one of the most holistic services. And we really, as a family, we were supported. You know, we were very lucky, very, very lucky. And we had a little baby who was really ill. He's now 18 years old. Yay, we've gone through. You know, it's the best outcome you could possibly do. And we were with the hospice from the time he was about 6 months till he was 3. And that's another conversation that I just wanted to raise. But I think the biggest part of me was that from his perspective, he needed a lot of clinical care. Yeah. But he didn't know what was going on. He was fine. The rest of the family with the other children, we were living through considerable trauma. And what was so helpful and supportive from Christopher's was that family support. The two other little ones were really well supported with a play therapist. Was she a music therapist? I can't even remember, but she was absolutely amazing. And the conversations that we had with the various nurses or the support workers just got us through, and we were allowed to talk about all the possible scenarios, and being able to have conversations about a child dying without the taboos that everywhere else in society. It was very liberating. It was sad, and there were lots of tears, but to be able to have those conversations was so important. And I think that's what Christopher's for me was, and what you're describing is the support that the structures you have to put in place to do that, as you say, are really vast. I think apart from that numbers of children, one of the things that feels important to talk about is who are the children that you support. And from, I remember having that really tough conversation where our son had surgery and somehow he no longer fitted the criteria. So we had to try and find different support somewhere else. And we were very, very ably helped in that transition, but it was really hard. And I think it's probably worth a conversation to understand who are the children that you support.
Yeah. So the children that we support are obviously children that have life-limiting conditions. In terms of, so I guess the starting point would be that a family would need to be referred to our service to be able to access the services that we have on offer. And the referrals can be done by anybody. There's all information on our website. So a family themselves could refer.
Right.
It could be done by a social worker, a GP, a consultant, anybody. But the general criteria for us is that we support children, young people with a life-limiting condition diagnosis who are unlikely to reach their 18th birthday. There are lots of other conditions that fall within that criteria. But I think to go into that into so much detail, the age is obviously a factor, and the geographical area is a factor. But we have oncology, epilepsy, neurological. The list goes on, respiratory criteria. Duchenne muscular dystrophy. There's lots of others, but the main criteria is that it's a child or young person with a life-limiting condition where they're unlikely to survive until their 18th birthday.
And I think that it's really interesting, isn't it? Because we're talking about children and we are in the 21st century and medicine is as advanced as it's ever been, that can change. And our experience was our son had a life-limiting condition, absolutely. And then, with the intervention of medicine and also I think the other aspect that we often don't know with these really complex children is how they are going to grow. In a year's time, their condition might actually have changed quite considerably. And again, helping families through that, you think you've kind of made your peace with the situation, and then all of a sudden it changes, and that 180-degree turn, even when it's really positive, can feel quite traumatic. And leaving an environment like Shooting Star it's really hard because you feel so safe there.
Yeah.
And similarly, I can imagine that when an older child or a young person has to enter your service, that must be a whole different kind of upheaval.
Yeah, that's quite difficult. We've said said goodbye quite recently to some of our young people that have been with us for a number of years, that have just turned 21. And we try and make that whole experience a celebration for them. But actually, for some of our young people that are cognitively able and do have those skills of and understanding kind of what's happening, it's a big part of their life that they're saying goodbye to.
Yeah, absolutely. The other thing that I think is probably worth talking about a little bit is that you are not part of council services, are you? Are you a charity?
We're a charity. Yeah.
You're a charity.
Yeah, we're a charity.
And you mentioned earlier about the fact that the funding from government for children's hospices is minimal. The resource, I imagine, to support a child and a family with this complexity of need is huge, which presumably limits the amount of children that you can support, hence, apart from anything else, all of the criteria. How do you manage? I'm kind of interested in how does a children's hospice stay alive?
We have an amazing fundraising team who are constantly and consistently thinking up some amazing new ideas of how we can raise funds for the hospice to keep us going. We have our patrons again who are hugely supportive and do so much to be able to help us and to keep us going. But yeah, I mean, it's a considerable amount of money to keep the hospice running. I don't know the exact figures, but I mean, when you think of the families that we have, the number of families that we have, we only really have sort of 6 beds open per night.
Right.
So that kind of limits, especially now where we're only under one hospice for our sort of clinical care. So we've had to change our services slightly, where we used to be able to offer our families a number of charitable nights per year. Yeah. But now we're kind of under the one hospice. We are able to offer charitable stays for families around when they've reached maybe a social crisis or a clinical crisis. For all that planned respite, we now look at having that funded, and that usually comes from a statutory agency. So for example, health or social care. So that also brings in some income. But we, again, even through that funding, we only ever ask for a contribution towards that stay. It's about 1/3 of the actual cost per night that we ask for to be able to support those families for around that planned respite. So it's, the figures, I'm probably not the best person to be able to go into all of that, but
I think you give us a really good flavour, and I think it is an important part of it. The other thing, I know we're probably going to come towards an end, but one of the things that I wanted to raise is it feels really important to take every opportunity available to highlight the work that you do and the voice of the families that you support. I know we, in our work with the authorities, we often see a representative of Shooting Star in a number of these meetings, because these families often feel very invisible and very forgotten. And I wondered how you work, that how can we as a whole system make sure that they may be a minority of families, but they are families going through the most intense experience of childhood and parenting, and they have so much, I think, to offer in terms of what is the Surrey experience of additional needs support, and how can the experience of your families help make the whole system a better one? Gosh,
I mean, I don't really know how to answer that, to be honest.
Well, I suppose it's about gathering those stories, isn't it? And hearing, and I think, my experience of families that I met there was that they, because they have such an intense experience of parenting, they often come with a clarity of thought almost. And there's a piece in a lot of the families I met that I felt was just so, I wish more of us could hear and could have a little glimpse into this different parenting, because it makes us see childhood differently, doesn't it?
Yeah, I mean, it's really tricky, isn't it? Because I mean, we have our website where we have family stories within there, so people can kind of read what families are going through. But again, that's kind of our, we have a wonderful communications team again, who kind of they work really hard to get those stories out there, to really kind of highlight us as a service. I know at Christmas we always do a story on a family around Christmas, and I know that that's currently being worked on, and that will be going out quite soon to really sort of highlight a family in particular that becomes our focus. Is that the kind of thing that you were?
I think it is. I think and it's just that talking about it comes back down to what are the families' experiences, doesn't it? And how do we work as a system to make sure those stories have a part to play in improving things for all other children. And mostly one of my personal little mission in all of this is in some small way, maybe to say these families shouldn't be isolated, shouldn't be hidden. We shouldn't be afraid to talk to a mum or dad because their child is dying.
Yeah, absolutely.
And I think that's something that you all do with such incredible grace. And you see the children.
Yeah. And I think in those situations, although they're hard conversations to have, actually, you know, those parents are really appreciative of those conversations, because it's kind of like, oh gosh, actually, you know what, it's okay to talk about this. You know, this is our life, and being able to have that support and those places to go where people kind of understand what's going on. And yeah, I mean, like I say, we have immense support within the hospices that where families can go just chat to one of us, just really kind of just openly, if they just want to have a general chat, or we have like the structured support in place in terms of sort of counselling and therapies. So, you know, it's there in place in lots of ways, really.
Yeah, it sounds wonderful. That feels like a nice place to come to an end. We will obviously make sure that all of the links to the website are in place. And if any of you have any questions, have any conversations, we at Family Voice would absolutely love to facilitate those. We work on and off with Shooting Star and various different aspects of our work, and they're always a very insightful organisation to work with. So thank you so much, Fran.
No, thank you.
And I hope we can have a further conversation. And if anybody wishes to, you know, help with the fundraising, I'm always a big supporter of children's hospices. Thank you so much, Fran. And I will wish you a good day and the rest of it. And I'm going to press stop.